So I work for 211 Info based in Portland, Oregon, and we provide the 211 phone service for Oregon and 4 counties in Southwest Washington. 211 is a federally recognized telephone number, recognized by the FCC in 2000 to be the go-to for information and community resources. Going back to 2018, about 6 years ago, we met with Taylor Justice, and him and Dan Herman, our CEO, did a road show throughout Oregon to socialize utilizing the platform for Oregon's CIE project. And with that, we launched a regional coordination center in January 2020 at the onset of the pandemic. And we also have a data sharing agreement with Unitas as well, where our entire resource database is ingested within the platform. With 211, when you call, it is anonymous, it is confidential, and we don't always know the outcomes after providing a referral to a client or to a household. And with Unitas and with our coordination center, what we're able to do is meet with a client on a first name basis, get to know them, their household, follow up with them, check in, identify other resources that may not have come up if they had called 211 and been anonymous. And so it's very much trauma informed, it's client-led and client-centered, and we help engage clients and think of things outside the box that maybe they didn't think of before. Our agency is working with a number of CCOs or coordinated care organizations. So these are regionally based organizations that serve the Medicaid population. And with certain CCOs, we are taking a proactive approach to outreach and engagement, and we are calling each and every person that has been pre-selected or pre-identified to be eligible for the programs that Oregon has defined as having a need. So climate devices started March 1st, housing supports will be in November 1st, and nutrition supports January 1st. And what we're doing is screening folks for social needs and determining whether or not they're eligible for HRSN. When we first started using the platform, trying to find the person who would send a referral to the coordination center was almost akin to finding a needle in a haystack. And now with the directory and the chat service, we're able to directly message the referral sender, and then also the chat functionality where if we have questions about an issue we're having with the platform, that's very responsive as well. It's definitely important, especially when we are talking to elected officials about gaps in communities and gaps in services. We can really hone in on zip code data. And so when we're meeting with folks whose legislative districts map over counties or map over zip codes, we can let them know that there's a high need for diapers or a high need for medical transportation in your jurisdiction, and then they can match that up to what their constituents are calling about. I would say that as more people join our network in Oregon and Southwest Washington and learn about community resources and how really to connect the dots between other service providers and then that connection to 211, we serve as sort of that middle entity or stopping point where folks can choose which direction to go if they want to refer their client to the coordination center, or if they want to learn about resources from 211 and then refer on their own to a CBO. It's just kind of that nice amalgamation of service providers coming together.